Hi there. Welcome to Conversations, where we seek to advance your leader and team excellence by discussing relevant topics that impact today's organizations. Welcome to the show. Hey there, leader. In today's conversation, we will be talking about better habits for pandemic resilience. How many of you out there are needing a little bit of resilience right now as we dive deeper into the COVID-19 crisis? But we as a nation are on our way up. And today we have with us Dr. Stephen Stohler. Dr. Stephen Stohler is a chiropractic physician and a certified lifestyle educator. Dr. Stohler is the driving force behind his organization, Fundamental Health Solutions. His expertise lies in assessing the body and designing individualized wellness and lifestyle programs. For all you Clifton Strengths enthusiasts, Dr. Stohler leads with developer, activator, restorative learner, and responsibility. Dr. Stohler, welcome to the show. Hey there, Dr. Steve. It is great to see you. How are you today?
Very good. Good morning, Dr. Kelly.
Ah.
Doing well. Excited.
All right. I'm excited too. I'm excited to have you here. It's just so nice to have you on the show. And I certainly appreciate you just taking the time, just to kind of pause and be with me on the show and really to add knowledge around resilience and staying healthy. And I get to talk with a lot of leaders. And there's one thing that sets, a good leader apart from a great leader, and that's all about the passion that they have around the work that they do, as well as how they serve others. And, I know you personally as well as professionally. So that passion does shine through as you promote, this lifestyle of wellness to people. And that's not just in Southwest Florida where you're located, but people come to you from around the nation and they have benefited, from your expertise. And I think that's amazing. There are so many
Thank you.
topics. You're welcome. So many topics that we can, talk about and pull from today because of your, expansive expertise. But today we're going to really talk about what's on a lot of minds of leaders, and that is COVID-19. And we have these guidelines that have been passed down, and they talk about social distancing, washing hands, protective gear. And I'd love to hear from you about maybe the top 3 things that leaders can do to maybe lessen the risk of contracting infection or developing serious complications moving forward, because we still are in a pandemic.
Mm-hmm. Mm-hmm. Yeah. Thank you for letting me have a little platform to talk to people about it. As everybody knows, with the COVID-19, there really isn't a cure, right, for this viruses. I mean, viruses kind of occur and have occurred and will occur in the future. So to set yourself up to try to be resilient, you have to have like almost 2 mindsets. You have to have obviously the acute, I'm in a situation mindset, but then you also have to have more of that long-term mindset of like, well, how can I make myself the best I can be, or my best self, my best possible self in the future, so that my resilience is up, right? So since we know that viruses, they just can't be stopped, they can just be managed, right? So that this is, I've talked about this with you before, problems versus predicaments. I mean, this is a predicament. So some of these things that you cannot control, the seasonality of flus and viruses and that come through, you can try to get ahead of them with certain things, whether it's allopathic or complementary kinds of things, but there really is no cure, right? So with that said, best practices of what you can do to make yourself resilient is really your best defense, to combat not just COVID-19, but whatever comes next. Because before COVID-19, there was, SARS and MERS and all those kinds of things. Ebola, these are all viral infections. So obviously, good hygiene to a certain degree, especially in acute situations, but also not just getting so hygienic that you make yourself less resilient in the future. So there's times when you want to be super vigilant, And then there might be times that you might want to try to actually increase your at least bacterial exposure so that you can build some resilience. But some of the frameworks that I work with are simple lifestyle things, so where I come from is, is this think right, sleep right, eat right, move right, some of these basic lifestyle habits that anyone can employ. And you see the people doing it, and now I've seen it more than ever, just even walking around the neighborhood and things like that. But you don't really get as much focus on that from the top political leaders, because they're really trying to come up with obviously an acute medical survival plan. And so I kind of consider myself a bottom up leader rather than a top down leader, in the sense of what can the individual do to help flatten the curve or make themselves the best case scenario, so that they don't add or complicate the top people's problems of trying to manage resources and all those kinds of things.
Yeah, and that is great information. And I heard you say something there that I've heard in the past, and it's about the hygiene. And
Mm.
so there are times when you want to, yes, we want to be washing our hands and whatnot, but can you explain a little bit more about, allowing our body to not be so hygienic during times? What does that look like?
Well, the immune system is kind of divided into two big categories, and we were built that way, right? So we were about to have this innate immune system, which would protect us from outside infections, and then we have this acquired immune system where we memorize that response in our body, and we set up almost like stockpiling things to come up against it. Sometimes they're effective for new mutations of it, and sometimes they're not. And your body has to have that adaptability. uh, the hygiene theory would be, just no germs, no germs. I mean, we're in a culture right now that's actually gone to war. And clearly they say it, we're in a war, but we've been in a war for a long time against germs. And that has created superbugs in hospitals and MRSA and all these other kinds of things, because, how can you be at war with something that's a natural part of yourself? So to me, it's a
Mm,
little bit, I understand, obviously this is a big problem, and war is a very mobilizing word from a leadership standpoint, but, you can go too far in that process as well. So, some of the things that we're having problems with now, as far as our own immunity, which we clearly have problems with the immune system, not just necessarily this epidemic, but cancer and autoimmune diseases and those kind of things. It's all part of that system. So some of our principles of not allowing kids to get dirty, and not obviously being exposed to bacteria and those kinds of things actually lowers our resistance. We were designed to take in and some bacteria and to then create our own immune responses. And if we don't really do that, then we just don't build the system up, uh, and that doesn't serve us going forward. So it's kind of like, if we don't have the capacity already set up, then little things, or in this case a big thing, can really wipe us out with devastating effects. I mean, clearly this one is very virulent, and it takes people into very acute distress quickly. And if you don't have that mechanism, it's kind of like working out to a certain degree. If you never work out, just simple tasks will task you, and if you really try to load the system acutely, it just will break. And what we see is a percentage of these people are breaking under the
mm,
stress of it, because they haven't prepared themselves enough through many mechanisms, to be able to become resilient to that. Clearly what we see is, like, um, in the process, they high risk people. These are chronic disease people.
right.
These are elderly people, infirm people. You see it with nursing homes and things like that. Obviously, they were already set up to be high risk anyway. And then males, why do males live less long than females as well? So there's clearly some of these chronic disease factors are also players in this acute question that we're having. So while I think it's important to ask the acute response questions, it's also to think about, like, especially with this one that really likes people that have these chronic disease comorbidities, like, what can we do to to put ourselves in a better place so that we're at less risk. So they're not mutually exclusive, chronic versus acute. They actually, your chronic diseases actually have a huge influence on these acute, how you respond acutely to certain stresses. And this is just, in my mind, just in a pretty severe acute stress.
Mm. Yes, absolutely. And I think part of that, just knowing that the work you do, and you can tell me if I'm on the right track here too, is that you are all about nutrition. You're not just a chiropractor. You are like this total holistic doc. And so I'm thinking nutrition and playing into that, some of the things that you just said about, um, if somebody is already, has good health, um, how can they maybe boost that with nutrition? I'm just going to go there.
Yeah. Okay. Well, I mean, I would probably back you up just a little bit. I mean, yeah, yes, I really kind of consider myself, and I have spent quite a bit of time with lifestyle, more than even just nutrition. I think that, lifestyle modification, and I try to study lifestyle habits so it's not just necessarily what you eat. Again, it goes back to that think right, the thoughts that you think, or those, that psycho neuroimmunology or affective immunology. I think that is a big role. Sleep, that's another big component to it. I like to say that your best day starts the night before, for many reasons.
Yes.
The good night's sleep that you get will determine a lot of those things. So that's where our sleep right comes in. Eat right, clearly, we know that the foods that we choose can, determine our outcome with a lot of things. And then even movement. So, the moving, that has an influence. There's been a lot of research where too much movement can break us down, but too little movement can also break us down as well. So there's kind of a sweet spot for all those things. So I try to really focus on all those things. Then as a chiropractor, a lot of people will come in there, they'll say, I can't move because when I do, I break, right? I have pain. So, we try to come up with programs, that start them in that door, and then that goes that way. But as far as immune system goes and eating, I mean, surely just from a food standpoint, there's lots of things that you can do. I mean, the worst thing that you probably could do at this point is to be sitting at home and ordering or eating, way too many processed foods. I mean, one thing that the United States does well is that it manufactures disease
Mm.
pretty, almost better than most people on the planet. I mean, I tried to look at some of the more recent data. I mean, in the past, we've been 39th in the world for longevity, and they don't even measure health span. They only measure lifespan. And that's a little bit of a, strange number, but we've been 39th, for quite a few years. I looked on one site today, and it said we were actually down to 46. So somewhere between 39 and 46. So, I mean, how can we not expect to suffer really more than other countries, maybe based on we have a sick population, right? So, I mean, when it comes to eating right, it comes down to a lot of things. It comes down to as much as what you eat, as much as what you don't eat, and then even when you eat. So, there's lots of things that would tell us, what are those kinds of things. So, eating real food, that's important. This is kind of Michael Pollan's things, not too much, and preferably, vegetables, right? So those things always work for multiple reasons, whether that's the antioxidants or the polyphenols or the fiber that you get from those things. Those always work. And then, of course, there's obviously specific things that you can do beyond that, but we try to get people to do at least um, uh, intermittent fasting, where they eat in a window and then they abstain from eating in a period of time. That's one of our key things to talk about, because eating too much food actually it takes some of the energy away to process food, and it can sometimes not give our appropriate systems the time to rest, and then not eating, at all, that also, or caloric restriction also can impair our immune system. So, there's a sweet spot in there, and depending on what the person's tolerance is, that might be a 12-hour eating window or an 8-hour eating, depending on where they are. For someone that's, less healthy or less robust, they might not be able to go more than 12 hours without food. So, we try to scale it to where they are. As far as like things that you can do to beef up your immune system, which we've seen is as far as like supplements. So I like food as a primary source of nutrition, and and then supplements are just that, designed to supplement some of the things that we might not be getting from our diet. You know, from the 1930s, they've known there's certain things that are just missing, and then of course, if you're obviously eating processed food, there's quite a bit of things missing, or we wouldn't have all the chronic disease that we have, you know, and the drive to sometimes overeat. So certain things that obviously that you know, people can do just in this acute time, which if you see hospitals in New York as a standard protocol, you know, for the first time giving vitamin C, you know, intravenously, that clearly tells you there's something going on there that they would be doing in an acute hospital setting, and those people are sometimes having even better outcomes than ventilator patients. You know what I mean? So as far as that goes, so in this case, maybe the vitamin C is a very powerful tool to use. I mean, it's also interesting, like there's some kind of trying to get their mind around this COVID-19. One of the first symptoms they talk about is like loss of taste and loss of smell, which is a classic zinc deficiency symptom. So, and actually the mechanism of, you know, the anti-malarial drugs that they're kind of promoting, it's a zinc ionophore. So it actually increases your zinc levels in your own body. So the drug actually does that by, you know, how it recycles, you know, zinc from your system and upregulates that. So that can boost your immune system. So those are just two key nutrients right off the bat that people are finding effective, not just with COVID-19, but, you know, just any kind of viral thing or any kind of immune threat. You know, that's something that, and there's lots and lots others, obviously, but those are the ones that are kind of getting the biggest play, you know, and why they're getting the biggest play.
Yeah, they're important. And those are great, you know, touch points for leaders to remember about, you know, exercising during this time, especially. You know, and that's great for stress management as well, right? Eating healthy as well as, you know, supplementing, you know, in a way that's good for your body. And I know that you do a lot of work with people with that. And so those are great while we're home, and that definitely I'm assuming should carry over. You know, after this stay-at-home order, we know it's temporary, and you know the nation will be going back to its quote-unquote normal state in the coming months. So as people go back to work, what are some maybe considerations or steps to take just to continue to protect themselves? And I know we just mentioned, you know, exercise, eating right, supplementing. Is there anything else that you want to add to that?
Well, not necessarily. I mean, that's a great place to start. I mean, it hits, you know, mind, body, and spirit, all in those things. But I mean, hopefully this time is a time for reflection and a opportunity to look at priorities, right? You know, so that's, I mean, this is a great pause to reflect on what's actually important to you, especially as people's pocketbooks are stressed and they have to discriminate between what they spend their money on as well as what they maybe, you know, spend their time on. So, I mean, my hope and prayer through all this is that having this opportunity of just like not having the hustle and bustle, you know, because it is hard to change habits, you know, especially when you're busy, right? You know, it's hard to, you know, to take on many new things and you're adding, you know, to your day. So we've had a lot of things taken out of our day. So we've tried to find things that would fill our day. And, you know, and a lot of people that I see just walking around the neighborhoods or walking with their kids or riding bikes or exercising, which I'd never seen in previous months. And I've been walking, you know, for a long time, and the traffic is much higher. So hopefully out of this, you know, some of the social protection that we're using, you know, will also carry over in these personal habits as well. And that we'll just prioritize like that fact that, you know, I really felt good when I took that morning walk. I'm going to figure out a way to figure that in. You know, I really felt better going to bed at, you know, 9:30 or 10, you know, I really felt better after I got a good night's sleep because I didn't, you know, so let me prioritize that good night's sleep, you know. Wow, I felt really anxious after, you know, maybe watching something that might promote negativity all day long. Let me turn on something that, or read something or do something that, really fosters some positivity. Now that I have the time to focus on some of these, positive things, let me focus on those kinds of things. So, I mean, I'm hoping that out of this is this reawakening of, what is our purpose, what's important to us, and really, just like we're discriminating with our finances, what we're spending right now, we're discriminating with our time, even more so, of how, we know we're going to have to go back to work, we know we're going to have to put a certain amount of time into those kinds of things, but maybe we should not try to, manage acutely our health um, at the next invention, or the next, obstacle that comes in our way, as far as the next virus or the new wave that comes back or something like that. If they're saying we're going to have another wave, and I can't say they are, and I can't say that we won't, but, why wouldn't I make myself ready, for that next wave right now? I think that preparedness is, if we're able to survive this, then why wouldn't we stay prepared and vigilant for the next time?
Yeah. I love what you said about this time, and I find it just a very interesting time where people are finding themselves in different situations. People are working from home or not working. People have their children at home if they have young children, and really being able to be still and know that this is temporary, but this is a time where we can do that self-reflection like you talked about, and really see, it is how we're living aligning with what we value. Is our work, how we're working, aligning with what we value? And so it is an unusual time, but it is my belief that this time is um, it's time to have this time. I'm going to say it like that. I think it's time for everybody as a nation and as a world to take a step back, take that intentional pause, and really reflect, mind, body, spirit, like you were saying, and really be able to get things right and how we're
Yeah, or
aligning
work towards,
ourselves.
I mean, the concept of perfection. Well, I can't do it perfectly, so that's actually like one of the lowest bars that you can set yourself, is to perfection, because it's so unattainable that most people
Yes,
just opt out, right? So
that's right.
I like to say little things make big differences, and we're both people of faith, so um, if everything is divinely driven, even uh, you, sometimes for protection, sometimes in this case for maybe correction,
Mm-hmm.
right? So that maybe this is a time where, like, we have to make some corrections, because clearly in many ways we're on the wrong path. If we weren't, we would be number one, right? I mean, if what
That's
we were
right.
doing right, if you're doing everything right, then you're going to be probably number one or number two, right? I mean, in the world, and we're clearly not that.
Yeah.
And so in this case, a lot of the focus has been on, you know, you can clearly see that even though we have probably one of the better medical systems for acute management in the world, no system can be good enough. I mean, the whole purpose of the flattening the curve is to not necessarily is to lessen the burden on our hospitals, right, and lessen our burden on those facilities. It's not going to necessarily, it's not going to change the course of the virus as much as, like, to not overload and break that system. So even though we have a great system, if we all need that great system at one time, it will break.
Mm-hmm.
So another way to, without expanding, this system to something that's not sustainable, right? Then the only other way it would be is to get people healthier. I've said it, probably 8 or 10 years ago, not necessarily in the context of this, but we were having a different kind of crisis, and it was, the healthcare crisis in itself, and, like, the costs were exploding exponentially, right? And insurances weren't able to cover that, and they were cutting back, and so, they're basically, the theory would be, there's two ways to lower that crisis: is to either cut what you pay for, right, and then you can lessen the dollars that are spent, or improve the people's health. Well, with some of those things, they cut what they paid for and did that, but we didn't necessarily improve people's health, because otherwise we wouldn't have gone from 39th to maybe 46th, right? So clearly we hopped on one thing, but we might have done better to work on the other aspect of it as well. So I think that's the kind of thing that I would bring about out of this is like, what can we do to be the best form of ourselves again? How can we pay attention to those people that want us to be the best form of ourselves? And, it takes work to be the best form of yourself, right?
Sure
So
does.
anybody that would say, oh, don't worry, I got it, I'll take care of it for you. I mean, I've had this discussion in the past, and I've set my office up different from that. People that come to see me, they have to be willing to put skin in the game,
Mm-hmm.
But initially, when I made that change in my own office, people that weren't willing to put skin in the game, um, they left, and then they were replaced by people that wanted to put skin in the game, but they needed just a little guidance. And the nice thing is most of these things are simple to do. But like Jim Rohn said, he was a great business leader. He said the things that are easy to do are easy not to do.
Mm-hmm.
So there's a lot of these things like going to bed on time, and I struggle with that one. It's easy to do, but it's also easy not to do. It's easy to just say, well, I'm going to just watch just one more show, or I'm just going to watch the lead into that, and the next thing you know, that's an hour of lost sleep. Or the same thing could be true with I'm just going to go for a walk, and then something in your day pops up, and I just don't have time, and then you just didn't get it done, right?
Or I'm just going to have a little snack outside of my window of eating
Yes,
time.
yeah,
I've
yeah,
been
that's a
catching
big one, right?
myself this
Mhm,
last week. It's like, because I'm doing that intermittent
mhm,
fasting that you suggested. And I've been doing it for over, what is it, like 2 months or so now. But then this week, all of a sudden, it's like, oh, I'll just have a little snack. And I had to catch
mhm.
myself. It's like, I did it once, I did it twice. And it's like, you know what? You can't do that. This is not good for you.
Yeah, it's a habit, and it really can sneak in. I mean, there's many people that talk about mindless eating, and you really have to, again, temperance is a virtue, right? So this kind of self mastery, and it's one of the core virtues that we talk about, temperance. So understanding that emotion. I mean, it's just like anything, any kind of those emotions, they can come and they can go, and we have to give them a pause, and then maybe give ourselves, and it does take a higher level of thinking to not just be driven by our emotions, right? But and you have to be willing to put yourself to some of those, restrictions. So again, training ahead of time for those things by just holding yourself to that disciplined schedule. And if that's your normal, then a day or two of slipping is, it's imperfection, but again, that's okay. But the habit
Yes.
of it, that consistent habit, or mindlessly just doing it and not having any kind of controls on the factor. And then once then you can't not know, right? So the nice thing is that nobody had to give you condemnation. You just convicted yourself, like, wait a minute, this isn't my
Did.
best self, so let me do that. And I like to do that better. People are used to condemnation, like, what? I can't believe you did that. And I mean, from their leaders sometimes, or or coaches and things like that. And that's not your style. And I try not to make it my style, as much, because I think it's a lower form of coaching, than empowering people to, self-regulate themselves, and to feel that conviction without the condemnation, because a lot of that condemnation just takes you out of the game, right? Your
That's right.
worthlessness, all that, start that negative self-talk. And then how can you do loving things for yourself when you don't think when you think badly of yourself, right? So
That's right.
you do loving things for yourself when you value yourself, right? And or whatever you value, you take better care of. So how can you, if you don't value yourself, or you think you're this, that, or the next thing, then you don't value yourself, and then you don't take care of yourself, and then you just keep repeating the cycle, right? So
Yeah.
breaking the
We need,
cycles, that's what
that's
we're
right.
both
Break the
about, right? Breaking.
cycle and let's focus on what we're doing right, not wrong.
Yeah. And then plus one it, right? Okay,
That's right.
once I've
Plus
got
one.
that, and then plus one it, right? And then where do I want to go? What's my next plus one? And then what's my next plus one? And I like to say, let's just take it up a notch, right? You got that one, let's just take it up a notch, and was had him in my exercise class this morning, and we worked through around. I was like, okay, let's take it up a notch, and then if you get to a point like it's overload, then there's progressions and then regressions. Okay, well, wait a minute, I'm in a different time right now. We're in a, now it's super busy. I can't stay at that highest level of those things. What can I back it down to? Because there's just so much fatigue going on. I'm getting myself out of balance with doing too much. So what can I do to stay in all those things?
Yeah. And, I think as a nation, we've done a really good job of, turning the tide and implementing, some healthy habits,
Yeah.
with the guidelines and, with people like you who are, a cheerleader for so many. Um, so, I know that your practice, and you've talked about this, is about, developing healthy habits. So
Mm-hmm.
what are some habits that, we should be continuing in order to protect ourselves, from that second wave if it does come? Because
Mm-hmm.
that's a reality that it could from where we are.
Mm-hmm. Well, like from the sleep right, standpoint is just like really setting, just like you said, strict time frames for your eating window. There are strict time frames from your sleeping window, that we know with the nurses studies in the past that, if you stay up all night and versus, if you have the late shift or the night shift, you're much more likely to, have diabetes. You're much more likely to carry more weight. Well, how does that happen? Those things all happen through inflammation and hormone dysregulation and all those things. So it isn't just simply, well, if I just, sleep. I mean, sleep has influence on all systems. So, really setting a strict bedtime is, one of the best things that you can really do. And of course, and while it's ideal to get 7 to 9 hours sleep, just like it's ideal to eat kind of in an 8-hour window, there's a clock that's inside your body. They're called circadian rhythms. And, while yes, you can stay up till 2 o'clock in the morning and, and sleep your 8 hours and wake up, later, it's not ideal with the timing of your body, right? There's an internal, we're connected much more than just ourselves. We're connected to, the whole system as much. And there are times when it's better to sleep, and there's times when it's better to eat, and there's really times that it's better to exercise. And so it's not just doing those things, but then in following the letter of, well, I slept 8 hours. It's like, well, did I sleep the 8 hours in the time that my body was designed to rest and, and recover, versus pushing it later, and then throwing off and then not being in sync with that internal clock or those circadian rhythms.
So what is
So
that
sleeping is
that
obviously,
window of time in your?
well, usually, I mean, you'll see it. It's like around in most clocks, and of course, with any kind of search engine, you can pull up designs of it. But the ideal time to be in bed is really like 10 o'clock, and then the wake up time is around like 6 o'clock. I mean, that gives you your obviously 8-hour window. But I mean, for a lot of people, and if that's hard for you, that just tells you how far um, how much you've adapted to an abnormal state or conform
Mm.
to kind of this abnormal programming, right? So if that's like, I can't go to bed, and I struggle with this, so I'm not preaching. I'm trying to talk to myself about this. Is like, I don't always live in the proper time thing. I tend to work too long, but I enjoy it. But again, a lot of people enjoy the things that they do too long, or the food window. It's the same kind of thing, 10 to 6, 11 to, 7 is kind of pushing it, I mean, George Washington, right? Early to bed, early to rise, makes a man healthy, wealthy, and wise. Or Benjamin Franklin, some of those, they follow those principles, I mean, those old wives' tales had a lot of value without the science. They didn't understand the science. They couldn't measure it, but there was a lot of wisdom in that simplicity that was carried over, that kind of, folklore medicine. But that's how those people lived. I mean, they lived those lifestyles. So the sleeping, of course, the eating, what to eat, what not to eat, when to eat, that's critical. And again, exercise. You don't have to be a marathoner. Actually, that can work against you, right? But somewhere between 30 and 60 minutes of moderate exercise. Moderate exercise defined as you can actually speak while you're doing it, right? I mean,
Yes.
you're not so out of breath that you can't form a sentence. So, and what's the easiest and best thing that we were designed to do? Walk. So, I mean, you don't need any fancy equipment and uh, to do those kinds of things. You just need to, feet, to do that. So if you have feet, you can walk. And then there's a lot to be said for being out in nature. There's a lot to be said
Mm.
for getting some vitamin D while you're doing it. And so, those are our main things. And of course, if you do those, you think the right thoughts, you eat the right foods at the right time, you sleep at the right time, the right amount of time, and you move the right amount of time, then a lot of the other, factors will take care of themselves. And at least you can be your best self. And the nice thing is about in our digital world is you can really track all that stuff.
That's
You can
true.
track all those things with sleep apps on your phone, and many people do, and step counts and heart rate counts with their the rings on their fingers or their watches, and all those things do is just prove the point of those simple basic things that when you've done all those things and you look at your resting heart rate the next morning and it's lower, or you've done it for 3 or 4 weeks and you're watching this downward trend of your stress levels and all those kind of things, and your body weight's going down and your sleep's getting deeper and you're logging more REM sleep and those kind of things. By the time you looked at it, you're like, wow, I'm getting my body in line with what is truth. And that like because we're both people of faith, that one of my favorite stories in that is like two good people, two nice people, two people of faith, built their houses, and one person built their house on the rock and one person built their house on the sand, and the wind and the rain came, but the one that was built on the sand was washed away. So it doesn't mean just because you're a person of faith you're not going to experience COVID-19, right? Or it doesn't mean because you're a leader you're not going to. But this is a real time to say, did I build my house up to code?
Mm.
Did I build it in code? And just like we've had when, because we live in Southwest Florida, just because we've had hurricanes in the past, the building code is not the same as it was when I moved to Naples in 1969. They've changed the building code several times. Why? Always after the fact
That's
of a
right.
devastating storm, right? So in this case, it's the same metaphor, right? It's a devastating storm that is sweeping through not just Southwest Florida, and not just the United States of America, but the world. And so I think that you would find that now maybe it's the time to take our own individual codes up a notch, right? Just
Up
like,
a
again, let's
notch.
take our own individual codes up a notch and really hold ourselves accountable, because guess what? There are people that come around to your buildings and they inspect and make sure it's up to code, right? Making sure that when you're working with a healthcare provider, he's keeping you up to code. I don't want to have a builder that's working with a a 1960s code book as far as wiring and wind mitigation and those kinds of things. And I don't want the same thing for my health. I want a healthcare provider that's going to say, okay, I know this is the standard we had before, but I want to, if you're willing, right? Because I don't want to have somebody
Right.
necessarily completely police me. I want to live in a free world, and I want to have free choices, and I want to have the opportunity to choose to do that, not just for myself and for my family, but to help other people out, so that there are those resources available for those people that need it. I don't want to be someone that, if I was a person that acutely needed it, I want to be able to not acutely need it for the next time around, so that somebody that does need it can get those resources.
Yeah. And what you've explained are really just simple uh, tweaks to somebody's normal routine if they're not implementing some of these things.
Yeah.
And I think
And I
that's the
think if you can
beauty of
find
it.
that join that. Well,
Hmm.
simple is all nice and elegant, and and it can be very efficient, right? I mean, you you know, sometimes if it's not simple, then it's not sustainable. And I mean, really, most people know, like, if they want to lose weight or they want to get in shape, it only takes a couple little things to do that, right? And then they're able to lose it. But
Hmm.
the difficulty is in the sustaining it, right? So it's a couple simple things, but I mean, we live in a world that we want to, as humans, we want to, we're knowledge seekers. We want to try to understand all the intricacies of all those things. And yet many times that answer, again, like those, old folklore medicine kinds of things, or, folklore, thoughts, right? They just are based on simple, but they're proven with science. So, I mean, I've always said that like, once we get on the other side of the complex, we'll find out just how simple things are, but sometimes you got to figure out, oh, that's why it is. But even again, it's not required that you understand the intricacies of, biochemistry or, the immune system. I mean, these are very, very complex systems, but, our designer understood those complex systems, so we didn't have to. He just gave us a couple of little things to live by, and if we just do that, it's simple.
That's right.
Most of the time, all it really takes to be healthy is just a good attitude. You know what I mean? If you have a good attitude and are willing, you can be a lot healthier than if you don't have a good attitude. But attitude's almost the prerequisite to
Yes.
that softened heart, to take in the information and apply it.
And we control our attitude.
With effort sometimes, but yes.
With effort sometimes.
Yes. Sometimes not successful, but again, it's not about being perfect, because I
That's
can
right.
easily, as you know, can be a victim of my attitude, but usually I can, get myself 1 or 2 days and I can get myself back on track, usually.
That's right.
Yeah, there's no perfection in here. I'm only can say this because I've made, as many mistakes, if not more, than most everybody else. So, but it was out of trying to be better, and then also, not wanting to experience the pain of not paying attention, that I was willing to, kind of suffer the lesser pain of being disciplined, right? Those kind
Yeah.
of things.
And life, we weren't designed to be perfect.
No.
We're designed to, yes, go above and beyond. I always like to say reach that level of excellence, and it's not perfection. It's totally different than having to hold yourself to perfection, because you will, like you said earlier, you will always fail, because we're not
Yes.
designed to be that way.
No.
But if we can, put our best foot forward, incorporate some of these things that you've been talking about today to increase our likelihood of being resilient now during this pandemic, but then afterwards, that's powerful. That's,
I
powerful
think it proves a
information.
great lesson. I think it proves a great lesson. I learned about that simplicity and complexity, kind of, when I was spending a lot of times with Dan Buettner's book, The Blue Zones, because when they really went into all these places that people were living, exceeded even, the most modern and sophisticated medical systems, with longevity and activity and the quality of life and health span, they came down to these simple 9, power steps that they could take, and they were all really, really simple. I mean, and yet applied over a lifetime, were really, really effective. So that that simplicity again comes forefront of, like, you don't really have to do a lot of complex things. And then one of the other things I wanted to talk about, is like the power. In the Blue Zones terms, they use the power of what they call silver buckshot versus looking for a silver bullet. And I think that's one of if I would caution anybody right now, it's, don't look for a silver bullet out of this, right? That would be a caution. A silver bullet, frequently misses its target, and sometimes can cause other kind of damage. But buckshot, the power of that silver buckshot. So it's like you get 3% from this, you get 10% from that, you get 5% of this, and then you have much more likelihood of hitting your target, which the target is optimal health. So, it's not just, it's not just exercise. It's, like if you say, what's the one thing that I can, do? Well, believe that you can be better, and then believing that you can actually be better. That's critical, because if you don't believe that you can be better, then you have no place to start, right? You're set up to fail. And then why would I want to be better, right? Well, whether it's for my family, those kind of things. And the Blue Zones talks about that, with faith and purpose being the most powerful modulators on your health span and your lifespan. And then add these other things in as well, right? But again, it starts with that belief system. But that we talk about that, it's a silver buckshot approach that I think it really has the huge dividends. It gives you a lot of compounded power, because you address multiple things in little ways, and then it goes back to that little things make big differences. You add up a lot of little things, that makes makes it a lot better for you.
Yes. Those are great takeaways. Yeah. It doesn't have to be that you're all in 100% with everything at the same time. You can step into some of these different habit changes in your life, and your end game, looking at the end game of how you're stepping into that, and how you are repeating those same processes, those good habits, right, to get to where you want to go, and knowing who you need to come alongside of you in order to help you get there, because I think
Oh,
that
yes.
that's part of it. And
Mm.
so, when we think about that, and we think about, you have a practice here in Naples, Florida. Yes, you help people here. You help people, in other places they come to you. So how can people connect with you if they want to hear more about what you do, if they'd like to, schedule some time with you? How can they get in touch with you?
Well, we're on a lot of the media kinds of things. I mean, we of course have a website, Better Habits, betterhealth.com, and we're in the process of redoing our website. But there is a landing page there and a connect page there that you can see. Certainly, we have a Facebook account where we one of the things that I love the most to do is once a month we have a get together and we share a dish, and we have a little information that we share, and we teach on different topics, and I bring in guest speakers, doctors and dietitians and chefs and things like that, and then we talk about all under that think right, eat right, move right, sleep right, all those kinds of topics, and we bring them in to share with the people, and then we post those old videos, those FaceTime live, and people are always welcome to join us for free, right? It's just it's a free access, and you can go, and it's fun, and it's
It is
food,
fun,
and then
and it
it's
is food. It's good
yeah,
food.
good food. Yes, Denise Peterson is does a lot of makes a majority of the food, but again, it's a shared dish event, so people bring in food, and that's the highest compliment, is when they're willing to share, put that skin in the game and serve others by making a dish, and sometimes they don't go as well, and sometimes they're, wow, everybody wants your dish, I mean, and so that's a good feeling, and so you can get to us that way. We're of course on Twitter and LinkedIn and those kinds of things, and then for most of my movement stuff, like well, I really want to know how to move better, I want to follow you that way, we do have a YouTube channel, and we have our Move Right Mondays, and we do some body weight exercises, and I use the stick mobility guys with their stick exercises, and I think again, those would just be above the just daily walking, right? So that so you want to, I'm doing my daily walking, I don't need any equipment, I just need feet, and I just need to have that good attitude about it, and but then what, maybe maybe I'm stiffer after I walk than I should be, or I've started to get back pain from walking. Should I stop walking? No, don't stop walking, but figure out why you might be walking badly. So going because just because you have feet doesn't mean that you're walking well, right? You can
That's
be
right.
kind of dragging yourself along. So move well before you move off, and that's the functional movement people. But so if you're having trouble walking and getting that 30 minutes in every day, well, then maybe some of those videos would help you lengthen or strengthen your body so that it can handle 30 minutes. Maybe you can only do 10 or 15 minutes. That's fine, right? So then what can the body was designed actually to like stress, right? We are, the more we stress it within reason, the more it actually grows and improves, right? So stress is that catalyst to be better. Too much stress obviously crumbles things down, just like what we're seeing right now, crumbling of our finances and crumbling of our healthcare system, and crumbling. So it's obviously too much stress at one time, right? But if we can rebuild from that, and then develop more resilience out of that, whether it's our economic standpoint, or our health standpoint, those kind of things, and we can rebuild that. And I believe that, and that's how we're wired. You take a little baby and it has no strength, and you let it apply it, stress to itself, pushing and pulling on the floor. And next thing you know, it's up on all fours, and the next thing you know, it's pulling itself up the table, and then off it goes around the room. It's just, unfortunately, we sometimes forget to apply those same stressors to ourselves on that ongoing basis to maintain those things.
Yeah, just like leadership. A little
Yeah,
stress is okay. And a lot of leaders are going through some stress
for
right now,
sure,
but it
for
is
sure.
all about that learning and growing and that tension that you talk about.
Well, and leaders, I mean, you really have to, if you want to weather these hard times and be able to provide leadership, we, of course, just like the people we talk to, we have to be the best form of ourselves as well. I mean,
Yes.
if we're not doing it, then how can we speak about it?
Mm-hmm.
So I try to put myself to the hazard, and each year come up with a little more and plus one it, and take it up a notch as well. And I certainly have things to work on, and just as everybody else. But we can't get too far out in front of people, but we can't, drag behind, because if we're dragging behind, then we're not leaders.
That's right. That is correct. Well, Dr. Steve, it has been a complete pleasure to have you
Oh,
on the show and really advance the conversation of staying healthy, how to be resilient, during this time, but also beyond. And some of those just simple habit that people can implement. Those changes can mean so much. It's not about, like you said, it's not about perfection, but it's about really just staying the course and being able to be your best self by incorporating some of these things that you shared today. So thank you so much. I appreciate
no,
you
thank you,
and your
because
knowledge.
you do a great job with this, and then hopefully, added something to people thoughts anyway, and thank you for the
Absolutely.
opportunity to be able to speak. I always appreciate talking with you and getting to talk with your people, just like having you talk to my people. It's nice to be
Yes.
able to share insights. So thank you for the opportunity to share.
Well, you are welcome. All right. Well, I will see you soon. Thank you again, and
My
you take
pleasure.
care and stay safe.
All right. Thank you. Thank you.
You're
Have a great
welcome.
afternoon. Bye
Okay,
bye.
you too. Bye-bye. Until next time, this is Dr. Kelly Whalen. Keep doing great things because our world needs leaders like